Yes.
Good. Awesome. Thank you. Okay. So I'm really happy to be here today, virtually, maybe someday in person, to talk about what the arts can do for us in radiology. This should be hopefully a fun talk. I really hope it's going to inspire you to think about how you can include art in your life. So if you need to get a little bit of coffee, a little bit of caffeine, this is your time. I'm just going to be doing a little bit of introduction for a couple of minutes here. I know that's an important thing at this time in the morning. I'd also like to pause and say that if there is not a line at the bottom of some of the paintings, it's because they're my own paintings. So just as far as crediting purposes, I want to use some real life examples. So, oops, sorry, it went forward a little fast. I'm going to talk first a little bit about my story, just to explain why I'm here. So I have had a long interest in both science and art, especially painting. This is from a Christmas back in the 80s, which you might be able to tell from the neon t-shirt. I've always loved painting and also running. Perhaps you maybe have some interest that date way back like this that you've always kept doing. In second grade, I was asked to draw what I thought I'd be when I grew up. Apparently I thought I'd be an ENT, so maybe close, but not quite. I kept running and painting, but those were kind of secondary interests. I had to keep them separate. I was an art major in college, but it was one of those things that was almost something I was doing on the side. It was secondary to pre-medical studies. And something that, people sometimes look down upon, in medicine and science. So it was something I really did keep as fairly separate. I kept painting during medical school and residency. But again, a lot of people didn't know I was doing that, right? So it wasn't really something that you'd necessarily share. So how did I end up here at Vanderbilt with a job that in some ways is a dream job, being able to combine art and radiology? That in itself is a little bit of a story, which I'm not going to go into today, but basically it's because there really are strong links between art and radiology. So we're going to talk about that a little bit more, how art relates to radiology, also what art can do for you now, as far as within your department, also in your future practices, hopefully, and what are some practical ways that you might be able to incorporate art. So maybe when you're out in the world, you tend to notice things that your friends might just naturally walk by, right? Why am I starting off with talking about toilet paper? It's because we're noticers in radiology. We notice these strange things that just pop up in daily life. That's our job, really, to be good noticers. So how could we be better at that? Could the arts help us? We're going to talk a little bit about some background as far as art and medical education. When we're out there in the world, sorry, my mouse is a little bit sticky today. When they're out there in the world, we do see various examples of art that are helpful to guide us and also to teach us, such as at the zoo here, the National Zoo in Washington, D.C. We have art that's used in medical education in a pretty traditional way, right, for teaching anatomy, maybe for drawing pathways, for learning pathophysiology. But it's been somewhat separate until fairly recently. There have been some initiatives just in medical education in general across many specialties to help trainees learn about visual diagnostic skills and other areas like empathy and communication. There even has been a review article about this. So there are some papers out there, but it's kind of a little bit sporadic. The American Association of Medical Colleges has really recognized that this is something that medical educators do need to focus on, that it can be tremendously helpful in medical education. They actually have a newsletter, an electronic newsletter that they send out monthly, which talks about ways that programs can incorporate art into education and how that can be helpful. How about in radiology itself? Well, there are some sporadic efforts. They tend to be kind of isolated so far to date. These various societies here have done certain events and small initiatives to incorporate the arts. A lot of these efforts have been pretty small scale in general, like sessions to talk about how art can help in communication and in education. like Dr. Vischer here. Also, societies have had online virtual displays of art, things made by radiologists like the ACR and the SAR here. There have been some art competitions also by some of our radiological societies, but all these things have tended to really reach out to those people in radiology who are already doing art, who already have an interest. So is there more here? Are there actually other branches on this tree? Could really art do more for us? It seems like a strange topic, a little bit like this strange painting, right? How does art actually really truly relate to radiology? Is it just the superficial kind of stuff? So when you think of our workspaces and our daily work in radiology, a lot of it is a little bit sterile, right? We tend to have blank walls, we're in dark rooms, things are often, people kind of whispering. Maybe if you're lucky, there's some music in the read room, right? But not much art in general. We may use it in education some, right? Various signs. People sometimes do drawings to help with education. Is there more to it though? Is there more that we can do with art in radiology? So to get back to this, I'm going to talk a little bit about art history. So we're going to go back centuries actually to the Renaissance. People learned a lot about art and anatomy as an intertwined thing. A lot of art at this time really had emphasis on the human form. A lot of the anatomy was pretty amazing. This is taken from the cathedral in Florence, Italy. Some really cool figures. The skeleton I thought was pretty accurate. Pretty amazing what people did. Of course, famous artists at that time were also very knowledgeable about anatomy, like Michelangelo, Leonardo da Vinci, certainly. How about other areas that historically have combined art and science? Some areas of physics, right, like optics, have been helpful to artists in how they think about portraying things, how they think about color theory. So there is historically some overlap between medicine, science, and the arts. Radiology, though, how about that? So it turns out actually from its very origin, there has been substantial overlap between art and radiology. When Röntgen discovered X-rays in 1895, that was something that was of interest to science, that community, but also just to the general public. People immediately recognized that this was pretty cool new technology. Within actually just a couple months, there are various radiographs that were made by people out there in the community. These are a couple of Austrian photo companies who produced these really neat images of skeletons, of various just body parts, and even just things around the household. People thought it was something that was really neat to try out. So it was inspiring in an artistic fashion. People certainly recognized how this could be helpful in medical diagnosis as well. Artists immediately saw that this is something that they could do novel things with. There was a lot of overlap between photography, radiography, and the arts at this time. There are famous artists like Man Ray here who did some really cool things. But what about today? So that's historical. How could art really help us within our departments? Could it be a tool to help us do some of the things that we do every day? Some of the most important things we do are use our skills of perception and observation, right? We do that all the time. We're looking at things. Maybe you noticed this bejeweled plunger earlier in my talk. Do you remember where it was? Did you observe that? If you did, great job. You've been paying attention, right? That's what we have to do all the time, is kind of notice these sort of random things. So how could we be better at that? These sort of skills really underlie our ability to get through the list, right? Which sometimes can feel overwhelming, like a huge burden we have to lift up. So we really need to be as best as we can at observing and perceiving things. So let's think about that a little bit. When you're shown this image in the center here, you immediately think spoon, right? You just perceive this almost immediately. But what about some other details, like the handle, right? You might then, a fraction of a second later here, notice that the handle is similar across the various utensils. So that's helpful in sorting. It's basically pattern recognition. So in radiology, we're doing that all the time. We are looking for various patterns. We're looking for signs that point us to things, similarities across things. So when you're looking at chest x-ray, notice some subcutaneous emphysema that immediately cues you to look harder, right, for a pneumothorax. So we're used to using these clues to help us. Artists do the same thing all the time. They break things down into component parts, figure out how they fit together. And sometimes they form a very literal interpretation, like here. Sometimes things are more complex. And that's where learning about how artists think about things and perceive things could be helpful to us. In medical education in general, this has been used. Here are a number of articles. This has been used in various programs, not just in radiology, but specialties of all types, to help learners better see things, observe things, make these detailed observations. In radiology as well, it has been shown that studying art can help trainees in learning how to observe things. This study here, published in the JCR, had radiology residents look at a series of radiographs and point out where they thought the abnormality was located on that radiograph. They then did a fine art session, a guidance session at a local art gallery to learn how to analyze a painting. Following the session, then they looked at more radiographs to localize the abnormality, and there was a significant improvement in those skills of perception and localizing the abnormality after the art intervention, you could say. So in radiology, a big source of error is lacking perception, making errors in perception. So it's really incumbent upon us as a specialty to get better at this. It's almost our duty as educators to figure out ways that we could better teach these types of skills, and certainly of continuing interest, right? You can always be better no matter at what level you're at. Part of the issue is figuring out, when you're looking at the big picture, can you also keep in mind how you can keep in mind the various details that are contributing? It's the same way when we're looking at a painting, we're trying to figure out the big picture, but also still being able to appreciate the various brush strokes and the details. So it's a matter of looking at those details, kind of holding that in our brain, and also appreciating the whole of what's going on. Are we looking at a landscape here, various terraces, or looking at amoebas? It's hard to tell, right? So same thing when we're looking at a complex study. We may have the various details, but how do they fit together? What's the actual big picture? We're using these details and these clues to really analyze what's going on, or look at a complex case, a complex CT or MRI. Same thing as looking at a complex, strange painting like this. Looking at the details, trying to analyze what's going on and figure out what the meaning is. We do this in our work to really decode things for our clinicians. Artists do this too. In radiology, of course, we're deconstructing things all the time. We're breaking things down into organ systems. We have those macros, the standard reports that we use, where we go through and we list off each area, each organ, and what's abnormal or not. So we're deconstructing what's going on and then coming up with the whole pattern. So with artists, we look at other people's works and we try to figure out how they did that. We also deconstruct things, try to figure out what is underlying things. How about what is missing? So in art, we often talk about negative space, what is missing. Same thing in radiology, right? That can be very important as well. There are hidden clues sometimes. So if you've seen a lot of x-rays, it's probably immediately obvious to you what's missing here, right? So the clavicles are missing in this patient with cleidocranial dysostosis. So it's a classic diagnosis. It's the kind of thing, though, that's something that's a skill that we really have to hone with practice. Artists also do this all the time, looking at negative space, looking at bare areas, what to include, what not to include. So very similar techniques here. How about other areas in the humanities? There are certainly other things that could help us, like some theories in psychology may help us with figuring out sources of error. Maybe we can figure out why we're prone to using a shotgunning approach by studying psychology more. When we see a image like this, how do we figure out what's going on? What's important, of course, is the context. So in art, the context is important for figuring out why something is there, why the artist put something there. In radiology, it's the same kind of thing where we may be looking at one detail, but trying to figure out the significance. We need to figure out the context within the piece, within the image, within the story that we see in the patient's chart. So a lot of things go back to similar meanings. There are a lot of parallels here. When we're looking at art, what's happening in our brains? Are there actually any differences there that we can see? So this has been studied with fMRI, and it turns out there are increased connections that we can see when people are observing art, when people are making these perceptions, and that there are actually even more connections when people are creating art. So it's pretty interesting. It actually suggests that perhaps creating art could be even more powerful than observing art, but they're certainly both helpful. How about other areas in radiology? How might art help? So in radiology, we live essentially in uncertainty, right? We're making these diagnoses. We certainly hope we're right, but sometimes things go wrong. We don't really know, though, when things are going to fly off the rails, when things are in that state where we're trying to figure out if something needs to be worked up, right? So we're essentially gatekeepers for imaging. Some things need to be looked at further, but not all problems necessarily need to be solved. Art deals with this as well, and there are actually sessions, there are actually pathways in art for learning about how you can deal with ambiguous situations and how sometimes it's okay to have multiple interpretations. So this may be another thing in art that could help us with our daily work, living with that degree of uncertainty. How about empathy? Art can definitely help with empathy in many ways. So empathy relates to some things that are important just for general training purposes, right? Getting to interpersonal communication skills. And it really is something that some people is actually, maybe even more important than just perception and observation. It has been shown that having sessions, structured sessions like visual thinking strategies type sessions, which are guided sessions to look at art, can actually improve skills in empathy, as well as dealing with ambiguity. I would say that self-empathy also is something here that art can help us with. So we know that burnout is a huge problem, as well as things like suicide and mental health in general in the medical profession, and certainly in radiology. Physician suicide is approximately twice that of the rate of the average public. So this is something that we all need help with. And the arts have been shown to improve how people can handle stress. It's a way for people to have a sense of self-actualization. I've witnessed this firsthand. On the left here at the top is my former teacher and mentor. He was my program director when I was a resident. Amazing, really inspiring person. He developed a GBM when he was at the peak of midlife. It was really sad. And he died pretty quickly. It was really a traumatic event. But I was close with him and his husband, Randy, there. And Randy asked me to create a painting so he could have a physical remembrance in his home. So that was a way for the two of us to connect and process our shared grief over this loss. So it's very powerful. It can help us through all sorts of tragedies that we see, in our community and our daily work. It's a way to kind of work through those things. This is a painting I did after the Boston Marathon bombing, which I happened to be at. And it was a way to deal with something that was very difficult. So arts can help us in this way as well. It really gets at that issue of well-being and wellness, something that we all know is not by any means solved for all of us. It does provide a way to step back from work and practice self-care. It's great to have quiet moments thinking about art or making art if you're inclined. It also can help us in even just more simple, smaller ways while we're at work. So if you have things that you're looking at and take a somewhat artistic mindset, you're looking at images, you maybe better appreciate how amazing the images are, really how beautiful they are, how they're really kind of artsy in a certain way. And that's not something you can hold in your brain all the time when you're trying to make a diagnosis, but it may give you a little bit, a small sense of joy as you're doing your daily work. It's possible having that kind of mindset could also help us in the future, maybe develop other ways to look at things. Maybe we could use more color, which would make images also more beautiful, but also, could contribute to diagnoses. There is also the mental beauty that we can have, just the beauty in making an amazing diagnosis, or maybe a diagnosis that's helpful for the patient, meaning a diagnosis where they don't actually have a tumor, maybe they don't need a biopsy, it's actually a good diagnosis. So a sense of appreciation there. How about other areas? Can art help us with promoting diversity, equity, inclusion? Certainly. So we all know from daily life, but also from research, that diversity is very important in teams to improve innovation. It's key to collaboration and teamwork. Art is really very much based in this idea of celebrating diversity, collaborating, promoting relationships, and understanding. So the arts could really help with these areas of humanism. It's a means of communication, right? Communicating across barriers. Sometimes you can communicate better by making a short drawing to convey something to one of your colleagues, in a conference or a teaching session, or even communicating with patients. It's a way to promote community building. It's great for social programming for events. It's something that people don't always think about, but it can be a great outlet for doing things outside of work to build community. This has been studied to some degree. It has been shown that radiology residents actually have had really positive experiences with peer-to-peer bonding and doing arts-related events outside of work, because it is a novel type of experience outside of work that really establishes those kind of connections. So in education, arts can really be helpful in promoting a variety of skills, which certainly I would say would continue ongoing throughout your career as well. But what if we really want to push things forward, if we want to improve things in radiology? We need to innovate, right? So how could art help with that? When we're thinking about innovation, artists are often trying to think of new ways to do things, new ways to communicate. For radiology, we're thinking of ways that we could be better, ways to improve our technology, how we could work faster. For art, artists often look at how other artists do things. Artists, for their own work, may have multiple paintings ongoing at the same time here, which kind of forces them to use different colors or techniques that they wouldn't use otherwise by working on the same similar pieces at the same time. So in art, it's really based on this idea of trying things, of experimenting. There has to be some degree of psychological safety to this, but it's taking something that might be a mistake and running with it. So with this painting, I initially was not planning to have a splatter painting, right? I had a totally different idea, but a random splatter of paint fell on the painting and I decided just to go with it. So I created something I wouldn't have expected otherwise. But you have to be okay with this idea of seeing something that was a mistake and trying things out. Art very much is this way. People do a lot of sketches. This is why you'll often see similar works by the same artists, because they're trying things out, different ways of doing things and working towards something. It takes a lot of perseverance in trying this, where you're having different layers, rubbing out lines that you don't like, trying a different color palette until you get to the points that you feel happy with. So it's a process of refining and working at something, even if you don't necessarily know the end goal, which is something that in innovation is important in general, just keeping at something. And maybe you don't even know what the end is going to be, but you trust in this process. So it's about embracing these types of mistakes and figure out what you can do with them. I was hiking near Mount Rainier with my friend Nicole, and her camera malfunctioned. there actually should only be one mountain in this photo, but somehow she got this double shot, superimposed shot. I thought it was kind of neat, so it inspired me to make a very unusual painting of Mount Rainier that I think probably doesn't really exist anywhere else. So taking something that was an accident and making something totally new you wouldn't do otherwise. So how could we use this in radiology to really improve the projects that we're working on? Art makes us try new things. It puts us in these scenarios where we have to try things that we haven't done before. I was recently asked to ship this painting, which was quite large, across the country, which is a big pain, to be honest, to put it in a box and ship it. So I had to learn a way to ship it that artists sometimes use. That is, you can take the canvas actually off of the stretcher bars, which I'd never tried before. And it seemed a little scary, but you can actually roll it up. So this is very textured. It turns out the paint actually won't crack. It actually works quite well. So I felt like I was able to do this because I had that mindset of, well, you know, I'm just going to give it a try because that's what we do and that's okay. I think we're often much more cautious in radiology, and this is maybe something that we can learn from. We are certainly cautious for good reasons. We do tend to do things in a very routine fashion, but if we're looking to innovate in our field, I think there are some things that we can learn from the arts in general about having that open mindset and about looking for inspiration in all different areas, whether it's in nature or in our own images that we're seeing every day. So when you're thinking about what you could do with your own practices, what are some things that might be actually workable for you? When you're out there in the community, there's going to be art, so you could interact with it and just see, you know, what type of joy it brings you, right? You may also just want to observe art. Art is all around you, but you could look at things in a little bit more of an analytical perspective and see what you can observe in the art of others. You may want to do something that's more interactive. You don't have to be an artist. You don't have to have an art degree to do these kind of things. You could, you know, play around at home with art, or you could do something that's more group-based. I actually had a painting party with a group of residents when I was a fellow, and it was a lot of fun. Nobody else was really into art or painting. It was just something fun to do instead of your standard party. But it was a great way for us to all connect. And many of us actually are still friends to this day. Or you can do more formal things. So some programs do art sessions with their residents. So small group sessions to go to local museums or art galleries to have, again, some guided instruction, like this visual thinking strategies type of technique I mentioned earlier. And that's where there's for some formal instruction by a trained instructor to guide a group through looking at pieces of art. And it's a structured question and answer type format to help you think about how you're observing, how you're perceiving things. And it can also help with skills of empathy and communication, as well as dealing with ambiguous situations. Art creation certainly could be more formal as well. You could take classes to get some instruction and to help you look at things a little bit differently. This has been studied as well in medical education. Residents, for example, were given a scenario in one of these studies where they were told a kind of patient story and they had to make a drawing based on that. And then they had some group discussion about why people came up with different types of drawings and what the different points of view were. So it is kind of helpful to do these sessions because it helps you see what people are perceiving that you might not have really noticed or thought about yourself. How about other areas besides the visual arts? What could the theater arts do? Well, for training, we should all be working through various scenarios, right? Like contrast reactions, handling difficult conversations with patients or other clinicians, And it can really help to practice these types of situations. It can help us feel the emotions that may come up in those situations, and also give us language that may be helpful in times that are emotionally stressful. A classic way of incorporating the arts is book clubs or writing clubs. It can be helpful for some people to have more private journal time. It's a way to tell your story, to analyze what's happening in your life, but also help you look at perspectives of other people, whether that's in the community or outside of your small community. And it is something that can really help us with communicating with others. On a practical level, there have been some papers about medical illustration and how we can improve that in radiology. This is a great one if you're interested in trying this out yourself. It can be a lot of fun. So it's a way to improve your presentations, as well as just to have a little bit of skill as far as communicating things on a daily basis. How about more simple things? I would say that there's some fun things that we could do in incorporating art in our workspaces, maybe even the culinary arts, right? So this is just a way to connect people and have fun as well. This could be more formal. When we think about our workspaces, we could incorporate some art, maybe better architecture or design into our spaces. When you think about things in the big picture, for centuries, art and architecture has been used to improve people's lives. Certainly we could improve upon that in radiology with our spaces. It would be a way to bring the community into our spaces as well and promote a more inclusive environment. When we're thinking about patient-centered care, arts also could really help promote that. A lot of the art that we have in patient areas is pretty bland, right? Flowers and landscapes and such. What if we had more inclusive art, maybe art that was reflective of our communities, art that really celebrated other cultures? We could have art that would be collaborative. This was a collaboration between radiology, radiation oncology, and a patient at my former practice. It was based off of an image of helping hands. So this could be a way to collaborate with our patients even, to really bring the community into our spaces. It's a way to answer that question, which I think a lot of practices have difficulty with, how to bring the community into radiology. One of the best examples I've seen of this to date is this People's Heart initiative, where they've taken art from the community to really celebrate the diversity of people in the community and bring it into their spaces. If you're interested in seeing more, they have some great videos up on YouTube showing what these spaces look like. It's a way to promote health equity. If people feel more comfortable in spaces in our clinics and hospitals, they're more likely to seek care. So I think this is a really neat initiative, and I hope that we can expand it into other centers. So I've talked about a lot of different things, a lot of different areas that the arts could help us in radiology. But different things inspire different people. So I'd like you just to think about what inspires you, whether it's a great teacher, a master of painting, things out there in nature, your family, your friends, maybe your furry friends, and how the arts could help you bring that sense of inspiration and joy into your work. I'd like to close with how you could begin your journey, some things you can do. On a daily basis, just taking a brief second here and there to really appreciate how beautiful the images are we're looking at, especially when you see something unusual. We see unusual sunsets and we pause to appreciate that. Why not pausing to appreciate the beauty in some of the images we look at, or the quirkiness? Notice things, just notice the small details and how that can really contribute to changes in our interpretation and how we see things, and the similarities across studies that we initially may think are different. When we're trying to promote well-being, is the arts something that could really help us? It definitely is. So when we're looking at programming in our communities to improve well-being, the arts would be one way that we could do that. It's a way certainly to celebrate diversity in our communities and bring our communities into work, as well as to promote creativity. and innovation, which is really going to be key to the growth of our field. You don't need a lot of tools for this. You can even try art on the floor like I did here on the right. You don't need an easel. You can make it very simple and it still provides a lot of the same benefits. So in the end, this is about a process of growth, both individually and collectively. Art really could help us grow as a field. Our roots as radiologists actually are in art. There's, again, historically been a lot of overlap there. And as we try to improve our field, this is really a way to strengthen that. We are poised really to be leaders in combining art and medicine. So enough of me talking. Time for you to think about how you can make your mark. If you're interested in reading more, I have a number of resources here. And I'd like to say thank you. It's really been a gift to be here today.